Attention hospital HR in Canada. Are you in search of the perfect insurance solution for your part-time and casual employees? Look no further. Meet Healthcare Providers Group Insurance Plan, your go-to option for ensuring the well-being of your team.
With healthcare providers, also known as HCP, you're not just providing insurance, you're providing peace of mind. HCP's comprehensive coverage includes medical, dental, and vision benefits designed to keep your part-time employees happy and healthy. There's even a package that includes life, long-term disability, and accidental death, disease, and dismemberment coverage for those who already have other group health and dental coverage.
It's time to bridge the gap between full-time and part-time staff benefits. With Healthcare Providers Group Insurance Plan, you can level the playing field and show your commitment to all of your team members.
Join the community of over 145 hospital sites who have made the smart choice. Visit healthcareproviders.ca today to discover how HCP can help you support your team in a meaningful way.
Is this thing on?
I think they can hear us a bit better now. Do you think they are ready to change the status quo?
It's one thing to get them listening, but now let's get them to act.
You are now about to witness the strength of nursing knowledge.
Hi, and welcome to the Gritty Nurse Podcast, an unfiltered and unapologetic podcast which discusses health and healthcare. My name is Amie.
My name is Sarah.
And we are your hosts.
Don't forget to hit the subscribe button wherever you listen to podcasts. Google, Spotify, iTunes, or our YouTube page. Please rate and review us.
Make sure you get our book, The Wisdom of Nurses. There's no better gift than giving the wisdom of nurses to nurses during Nursing Week.
Hi, everyone, and welcome back to the Gritty Nurse Podcast, a podcast about health and healthcare. My name is Sarah.
And my name is Amie.
And we are your podcast hosts. So today we're going to be talking about a different topic, something we've never really talked about before. We always talk about violence in healthcare, like we talk about physical and mental abuse, but this is a different kind of attack. We're talking about cyber attacks today. And it's really something that has been more and more common, unfortunately, over the last few years. And we thought with something that happened that was really big down in the States a couple months ago, it'd be important to talk about it because it's something that is happening all over the globe.
Yeah.
So if anyone has heard of the hospital system called Ascension, they were attacked back in May of 2024, right around Nurses Week, which is kind of a sick joke. And they are actually one of the largest nonprofit healthcare systems in the US. And all their internet-based systems were attacked. Each facility was attacked differently, but this actually affected about 140 hospitals. And this organization actually serves 19 states. So they first detected some unusual activity on May the 8th. I feel like that was right at the beginning of Nurses Week, right?
Yeah, that was the beginning of Nursing Week. Yeah, May 8th. Yeah.
Yeah. And they were investigating the incident. So some of the states affected were Alabama, Arkansas, DC, Florida, Illinois, Indiana, Kansas, Louisiana, Maryland, Missouri, Oklahoma, Tennessee, Texas, and Wisconsin. And what they noticed was that the electronic record system, or the EMR, patient portal, and some phone systems were down. People could not order procedures or medication. They couldn't do order entry. The health system actually asked patients to bring appointment notes as well as lists of prescriptions or pill bottles.
I'm sorry. I didn't mean to laugh, but I'm like trying to keep a straight face. And like, they did what? Okay, keep going. Sorry.
So that providers could call in medication needs. And some hospitals in Indiana, Michigan, Oklahoma, and Tennessee had to divert ambulances during the cyber attack.
That's wild.
So I just want to give like a quick rundown of numbers. So this affected 12 states. It was 36 days between the time that they reported the cyber attack and the time that they restored fully the medical record.
Right.
How much have cyber attacks gone up from 2022 to 2023? 128%,
Oh
according to the
dear.
Office of the Director of National Intelligence.
Oh man. I mean, I know this is not funny, but like it's definitely not funny because patient information or anybody's health information being shared widely with God knows who is horrifying. But again, like this is a problem. I definitely have to ask you, Sarah. Okay, so like so there is some training that is given, and I'm just going to kind of ask this question first, and I'm sure you guys out there in the healthcare world, and maybe not even, because I think cyber attacks happen at any organization. Have you ever been caught by one of those phishing emails from your own hospital?
No,
Okay,
almost though,
good
several
for you,
times,
because
several
man,
times.
I was really bad.
But what happens though is you guys all know if you work in healthcare, if you click on a phishing email, you get the gift of doing an e-module or training about how to not click on phishing emails.
It looks so real.
They look so real. They just basically want you to input your credentials so that these cyber attackers can hack into the hospital system and steal information.
Yeah.
So phishing, not phishing like with an F, but phishing with a PH.
Right.
That
Well,
phishing.
we'll probably talk a little bit more about like the various different forms of attacks, but I think what I'd want people to know is like this actually happens more often than you think. And I found that there were, with Ascension, that's like such a large system. It crippled a lot of like right across, it was like a ripple effect across the states, but it's happened here too. It happened in various different Southern Ontario and in Southern Ontario. It affected 5 different hospitals. And these things, like, I mean, in terms of the costs, it costs. Hospitals end up having to pay sometimes. Like sometimes they just don't know where the attack's coming from. There is a ransom that comes with it, and they have to pay to get their stuff back. And
See,
that's
this is
that's
the thing
wild,
that is
right?
crazy, right? Because where we live, the city that we live in was under cyber attack as well. And the mayor of our city actually refused to pay the ransom and chose to rebuild the system. However, in healthcare, when lives are on the line, this might not be a viable option. But I just feel like this whole ransom thing is getting out of control. Like a lot of times it's from different countries and
Yep,
there
I
are
was gonna
different
say.
laws. And unfortunately, they can't be they're not under like jurisdiction of Canada or the US. But I feel like this whole ransom thing, it's like a pirate, but online, like an online pirate. They're
It
just
really
like,
is. It
right?
kind of is,
They're
yeah.
holding your information ransom and it's so critical because it's personal health information, right? It's not just like, I don't know, Netflix, like what movies have you watched? It's like people's health information. It's really sensitive
Yeah.
and we need to protect that.
And it's not just health information too, it's also like SIN numbers, addresses. Like with this attack that happened in Ontario, they released all these people's SIN numbers, and that's horrifying because again, you don't want your identity stolen. And again, right now there's actually like a class action lawsuit of $480 million against these hospitals. Again, the hospitals aren't saying anything, but again, because so much of someone's information is out there. And I think this is actually probably another good question to kind of dovetail our conversation to is like, what are the concerns related to patient safety or patient harm? Because I do believe that when I was reading that Ascension article, they talked that there was harm that befalls patients when these cyber attacks occur. Like it knocks down EMR systems, the way that they might receive information or tests. You might not be able to get that information. It causes huge delays in care. I remember actually my brother was impacted at one of these various hospitals in southwestern Ontario, and I remember going to the hospital with him, and it was crazy. Like just the whole vibe, like everything moved very slowly. They couldn't find this, like they lost notes. And I mean, it's critical for someone who's ill to know what's going on, right? And then it's bogging down the system and creating this a huge risk to patient safety, and can cause, like I said, real harm.
Yeah, and I'm just thinking even from a provider perspective, right? As a nurse, you have your patients, and because the chart's not available, you don't know what medications you're supposed to give them, or maybe you don't know what dose.
Oh yeah.
My worry is that if anyone didn't get a medication or there was an error and something happened, God forbid, to a patient, who is going to take the blame for that? Who do you
Well,
think is going to take the
we
blame for
know
that?
exactly who's going to take the fall for that. And it's actually, I'm glad that you mentioned that, because one of the individuals in that Ascension article was an NICU nurse. And he's like, I almost gave my patient the wrong narcotic. And I'm like, Whoa. Again, there's that heavy reliance on technology. And I think this is like another piece of the question, as much as we could be like, oh, faxes are old, paper charting is old, they do come with some benefits, right? If we're moving to more and more electronic things, more and more use of AI and various different forms of intelligence. But again, when you are using a computer, it can fail. When you're using these things, it can, create issues where it just doesn't work the same. And I think that's that risk, right? Could you imagine if the system says, okay, you were, it was hacked, and it says that you have to deliver this, and it just messes up your whole, like, what you're supposed to do. And if you're not doing those proper checks, again, as healthcare providers, that is a part of our role. We have our, our documentation roles, our medication checks that we're supposed to do. But again, what if the whole system, in terms of the attack, they just mess everything up and you just weren't paying attention? That's some risky behavior.
That
right?
is really scary. And I wonder if in a court of law, if that would hold up. Like if you said, and I know this sounds bad, but it's like, I didn't know what to give because the chart was down. I could not access the
or
chart.
The calculations weren't there available. No, I think I don't think it would hold up, because again, we do have, I hate this word, downtime. Do you remember ever working during downtime?
You mean planned downtime?
Planned
or like,
downtime.
Okay.
Planned downtime.
Planned downtime was annoying, but at least we knew the stakes weren't that high, right? It was like a planned downtime. We're like, okay, we need to move to paper. But I've been in situations, and maybe you have as well, where it was an unplanned downtime,
right?
Not necessarily a cyber attack,
but like
maybe there was like a software upgrade or whatever, and things were down. And I remember having to go from chart to paper. So we get our downtime box, pull out the forms, dust them off, and then
go and watch the dust roll
and
away.
then I'd be like hole punching stuff so that it finished the binder, and I would write downtime charting, right? And then I'd start charting, and then the system would come back up, and then everybody would not know if they were supposed to like re-record everything from the paper to the chart. And then we were being told, no, it's fine, as long as you document it somewhere, it's there. I feel like it's very chaotic, and it seems like to me in healthcare, a lot of stuff is reactive. So until this happens to a certain organization, they may not think it's important to have these systems in place. And I think back to some of the places that we worked, we would have these emergency, what do you call them? Like disaster
the
code,
disaster planning, emergency preparedness.
So like, why can't this be part of that? Because I feel like this is as likely to happen, if not more, than an external disaster event where like 100 people might be coming to your hospital all at the same time. Like there should be actual cyber attack drills so that people know what to do, rather than scrambling when it's really happening in real time. Attention hospital employees and retirees in Canada. Picture this: a benefit plan designed for casual and part-time hospital employees and retirees who aren't covered by their hospital's group health plan. Introducing Healthcare Providers Group Insurance Plan, a friendly partner dedicated to your health and well-being.
With affordable plan premiums and an exceptional support team, Healthcare Providers, also known as HCP, is dedicated to helping you every step of the way. Enrolling is easy, and you'll have access to a wide range of health and basic dental benefits from day one.
Already have health and dental coverage through another group plan? HCP still has your back. For less than $32 a month, the Signature Package, which includes life, long-term disability, accidental death, disease, and dismemberment, provides valuable income protection and peace of mind for the unexpected.
So take charge of your healthcare and financial security today. Visit healthcareproviders.ca to learn more. Well, we're going to get to this. So training, one of the things that nurse said in that article was like, I had no training. I kind of smirked when I saw that, because again, I think this is where, the training typically for these things are really dry. It's like an e-module, or, it's that email that has tripped me up. I'm going to be honest. I got caught like twice.
Oh, phishing?
Yes.
And what did you have to do?
I had to do e-modules.
I knew it. Or did you have to read the policy?
It was like remedial. Yeah, I had to do like some extra remedial stuff. I'm like putting myself out here, but it was kind of crazy. Like I think it was, for me particularly, I was just in the heat of like reading an email really quickly, and I was like, oh, this came from like my direct boss. Okay, sure. And I just like hit okay, and it was like, this is a phishing scam. I'm like, oh my God.
You know what I've gotten
cut.
recently though? A lot of times I'm getting these fake invoices in my inbox from Amazon or like places that a lot of people would shop, right? But it looks fishy. So
Yeah.
I don't click on it. I just go to my Amazon account and see if there's anything there. And like I get it. We don't have time to do all this. It's just really unfortunate that we live in this world now where the phishing is so real. It's
It
like
looks so
a
good.
lot
Yeah,
more
it's
legit than it
crazy.
used to look.
And again, like I know they're trying. I don't know which way they can spice it up to make it a little bit more interesting. But again, like it's important that we are trained and that we can identify these emails that are, scammy or, that they might potentially cause that type of attack to happen at a hospital. And again, like again, cyber attacks can incur privacy breaches and financial harm, as well as compromise patient safety. Again, there's a lot of costs involved too. So again, losing your personal health information, they can be put onto the dark web. Again, they could put your credit card or any of that type of details up there. And then again, there was some work done by like IT decision makers. This came from an article that I read that says the average cost of ransomware attack was, and this was in the US, was $1.27 million. Wow. So it's not cheap when these things happen, right?
Right. And I think that I was sort of looking at how do we prevent this? And without getting into a whole bunch of IT jargon, right, one of the things that they said that I understood was something called two-factor identification. So, like when you go sign on to your banking, for example, it'll say a security code has been sent to your cell phone. You need to input the security code. So that is kind of the principle of two-factor identification. I think a lot of it is something that's at the organizational and leadership level that really needs to be looked at. I also think that governments need to pay more attention to this, and there needs to be stricter laws against it. And I don't feel like the answer every time should be that you need to pay the ransom, right? Because that's just going to further, like, this is why they're doing it, because people pay every single time. So if we can create systems that would prevent having to pay every single time, I think that would make sense. Obviously, I'm not an IT professional, but I think this just makes more sense.
Yeah, I mean, I go back to thinking even about like, even if they instituted something like you said, two-factor like identification or authorization, think about it from the nursing perspective. Could you imagine putting another extra stop? It's like I think a nurse would be like, this is just an extra annoyance.
I know.
And an extra thing that's preventing me again from providing care. But again, it's a part of like, this is still about how do we keep our patients safe? Like knowing and protecting their patient health information is a part of the game. So it's just like, it might be something that can be looked at to be something that could work, but it's just like, again, you're having to deal with the fact that it's now impacting workload, and people are like, workload, no more work. Mm-hmm. But again, you mentioned kind of like, how do we prepare? How do we train to kind of to be ready for these things? I think those two suggestions that you made are important. And then again, like you said, that we should rely on our governments a little bit to do more. And I think that again, if it's causing so like, it's happening more and more. So between 2009 and 2023, 5,887 healthcare data breaches occurred. So in terms of these breaches, it resulted in over 519 million healthcare breaches in terms of their records. And that's actually equates to more than 1.5 more of the actual entire population of the United States, which is crazy. So there's a lot of work that needs to be done. Like we need to take this seriously. So I'm going to propose to you, paper or electronic? Do we go back?
That is a tough question. I don't know. I don't know the answer. I don't think we should go back. I don't know what the
technology is a bitch, eh?
It is a bitch. I mean, we all know it's slower. Okay, we'll give you that. It's slower. Right. I will say it's easier to pull data. That doesn't help the front line, obviously, but it's easier to pull data. I also would wonder during every cyber attack how many adverse events there are as a result of these cyber attacks, and to use that as leverage as to why we need to put more resources into preventing cyber attacks. They're never going to
want to collect that data.
But like exactly, but that's what I mean. It's like, well, how many errors were there? How many delays in care were there? Like what is the overall impact, not just financial, to every single cyber attack? And this is what we really need to look at. I hate downtime. That's all I have to say.
Yeah, I mean,
downtime.
again, I think this is where we have to think about. We're moving into this over reliance on technology. Everybody's on their phones. Everybody wants that fast information. Everybody wants to, make sure that they get access to their healthcare records, and that would mean making them electronic. So it's again having to balance the fact that okay, we want these things. These things would be really great for us to have, but there is that risk. And again, we have to understand that, with anything, whenever we see change, particularly going from paper to electronic to using artificial intelligence, that there will be some risk. And again, I think that's just, we have to balance that out, right? We have to figure out what that is. I think there's times where paper charting is crucially important, and there's times where it's important to have that access to that fast MRI so you can pull it up really quickly. And I can only imagine how hard it was. Oh man, I'm maybe dating myself, when we didn't have that technology right at this at our fingertips. So again, it's just, I think we need to have a delicate balance. We shouldn't over rely too much on technology, but also just understand that these things can occur, and we need to be very mindful of them. Very mindful, very demure,
yes,
very cutesy about healthcare information. But yeah, I mean, I think that at the end of the day, there's just got to be balance. And I think that we've seen it in emergencies. For example, whenever there's like a code orange, people have to act quickly. You're literally pretty much in downtime anyways. So code orange is like external disaster, or like mass casualties.
Yeah.
And again, in these types of situations, we just have to work very efficiently. We can't forget the great skills that we had. We had them without the technology. So maybe that's where I'm kind of leaning towards, to just say, you know what, we do need to rely on those skills that we've had before all of this great stuff came into.
Right. And if anyone out there is old enough like us that remembers completely paper charting,
just paper,
it did work back in the day. We didn't know.
I didn't mind. I actually liked paper charting in labor and delivery. I thought it was actually faster. I
liked all those flow sheets. I like the flow sheets. I like being able to flip back and forth easily. Yeah. More than one person could look at a chart at a time, so you wouldn't have to like wait to sit down at the computer. Like there were good things about it too. Yeah. So I'm not saying we should go back. I'm just saying, like you said, there has to be a balance, benefit and risk as to what is really going to be the best thing.
So I did see, just a random aside, that in 2024, Hospital News in Canada said that they want to make 2024 the year of cybersecurity in Canada. I don't know to date where they are with that. It'll be interesting to see how we're doing, but not so great with this $480 million class lawsuit that's happening in Southern Ontario against these various 5 different hospitals, because it was a huge breach. So yeah, what are our next steps? What can we do? What should we tell people out there in terms of how to keep their information safe, and for from the healthcare standpoint?
Like, I think we just all have to be vigilant, right? Like we talked about, just using our critical thinking. When there's an email that seems a little bit different than what you're normally used to, just err on the side of caution. Don't open it. You can always report it to IT, or let somebody know that this looks weird, or just don't open it. Honestly, that's probably the better course of action. Don't open it.
Don't be like me.
Yeah.
Don't open the email.
And if there are any IT professionals out there, I think it's important to have your perspective too, as to how we can really counter these cyber attacks. If there are organizations or regions out there that have been safe so far, love to know what they're doing.
For sure.
Maybe there are countries out there that have stricter laws and they're more immune to this type of thing.
Yeah. So again, like you mentioned, cyber attacks can incur privacy breaches and financial harms, as well as threaten patient safety and healthcare functioning. There is something called the 4 stages, the 4 Ps, or actually it's not 4 Ps, sorry, just the 4 stages. So prevention, detection, response, and recovery. And then again, as novel areas of cyber threats emerge, so for example, like internet connected devices, clinicians and healthcare organizations should be vigilant for recalls, keeping software up to date, which is I'm really horrible at. Like if you look at my phone, it's already saying that I should update it. So make sure that your stuff is up to date.
Yes, don't ignore it.
Don't ignore it, because again, if you don't keep your software up to date, that's where it actually can leave you open to risks, to being, essentially attacked. So we also want to keep our workflows efficient and maintaining a strong cybersecurity posture. Although it does have trade-offs, they're minor inconveniences, like Sarah had mentioned, the 2-factor authentication, as well as, making sure that these things are far preventable and recovering. And it's like prevention is better than cure, essentially, right? So
yeah. Okay. So this was kind of a heavy it was kind of
Tech
a
heavy.
tech heavy conversation, but as you know, there's the intersection of healthcare and technology. We're not going to get away from it anytime soon.
We're only
If
seeing
anything,
more.
it's going to be more enmeshed into healthcare, so we
Yep.
should just accept it and do the best we can and stay vigilant.
Yep, embrace it. It's coming. We gotta do it. And
if anyone's
figure it
out there and you haven't changed your password and it's telling you to change your password, change your password.
and update your software.
Yeah.
So thank you for listening to the Greeners podcast. Stay tuned for next week. Actually, next week we will have no episode because Sarah and I are actually going to take a break.
Yes, we are. Vacation.
So stay tuned. We'll see you again in September.